Hey everyone, in this video I want to talk to you about surrogate decision making. So we're going to talk about it in two parts. First, who is a surrogate decision maker? And second, how does that surrogate decision maker make good decisions on behalf of the patient? So in the state of Pennsylvania, we have a handy law called Act 169. And this law details exactly who has decision making authority when a patient is either incompetent or lost capacity to make healthcare decisions in that moment. So the law is very straightforward. You can check it out in the PowerPoint, but essentially you have to be able to demonstrate three things as a patient in order to be deemed competent. You have to be able to understand the risks and benefits and alternatives of your treatment. You have to be able to make a decision, and you have to be able to communicate that decision. If you can't do those three things, we're going to need a surrogate decision maker to step in and make decisions on that patient's behalf. Now, in priority in the state of Pennsylvania, it goes immediately to the spouse. So husband, wife, whomever that might be, or partner. Next, it goes to adult children, then parents, so on and so forth. There's a whole list of decision-making priority. Now, this can get a little bit sticky, as you can imagine. With some families, say you have multiple adult children, we strive to generate consensus among those children when they're deciding for mom or dad. You might have somebody who was married multiple times, in which case spouses may want to have a say in the treatment and care of their loved one. So that can create some tensions when you're dealing with end-of-life decisions. And most importantly, when we're dealing with families, everybody's voice, we want to ensure that they can be heard in some way. However, at the end of the day, we do have a law that tells us who makes that decision. But as good clinicians, we want to be sure that we try to be as inclusive as possible to help the family deal with this trauma as easily and as well as they can. So, Act 169 is what gives us the teeth to say you are making a decision while somebody else may not be making the decision. Now, once the surrogate decision maker has been established, either through Act 169 or through some sort of advance directive, that does trump Act 169 if there is a surrogate decision maker preference outlined in a durable power of attorney for healthcare or a living will, that person does then have the legal authority to make decisions for the patient. So once we've established who the surrogate decision maker is, the question becomes, how do they make good decisions on behalf of the patient? Well, we have a couple of standards that we recommend to patients. You have to remember, when we're dealing with end-of-life issues specifically, this is a very emotionally charged time. It can be a very traumatic time for families. So it can be very difficult for the surrogate to make these kinds of decisions. So we usually recommend a number of different strategies to help patients through this time. So one of the key strategies that we recommend is called the substituted judgment standard, which is really straightforward. It's exactly how it sounds. We ask whoever the surrogate decision maker is to essentially try to discern what the patient would have wanted by looking back to evidence throughout the patient's lives, conversations they might have had, and in some, just really try to get into the patient's head and articulate what it is they would want based on their relevant values and beliefs. So this is great if the patient and surrogate decision maker know each other well. However, that's not always the case. In some cases, we have to remove that personal element, and in that case, for surrogate decision makers, a very simple way to think about patient care is to just do what is in the best interest of the patient. So we call this the best interest standard. Usually this can be determined by looking at the holistic care of the patient and what type of treatments will benefit the patient most, both in the short term and in the long term. So this can be done in consultation with the attending physician, with the care team, but the goal of this is to really maximize benefit to the patient, right? So this is a really great way forward. For example, if you might have an individual who is estranged from their family, this is a bit of advice that you can give them in thinking through a particular patient's care. Now, the last recommended standard that we use for surrogate decision making is something we call the reasonable treatment standard. Now, you might be wondering why substituted judgment or best interest standard might not work in all cases, because they seem to cover the whole gambit of patients you might come across. Well, I want you to think about a patient who has no interests. So this might be an individual in a coma, a chronic vegetative state, a persistent vegetative state. What's in their best interest isn't immediately clear. So we can't really use the best interest standard. The same thing goes for substituted judgment. If we don't have access to an individual who knew that patient well, it's impossible to use the substituted judgment standard. Rather, we rely on something called the reasonable treatment standard. And to meet this, we're essentially asking, what is reasonable treatment in this circumstance? What makes sense? If we don't know anything about the patient and there is no path to recovery per se, or a recovery that, gives the patient a chance at a better life or improves their quality of life, it becomes incredibly challenging. So we ask ourselves, what would a reasonable person do in this situation? So for someone in a persistent vegetative state, it could go a number of paths based on what's happening with them physically. The same goes for somebody in a chronic vegetative state. So we have to look at the entirety of the situation, ask ourselves, does it make sense to keep this person on artificial hydration and nutrition? Does it make sense to continue care in this direction or that direction? What reasonably makes sense? So those are three very simple standards: the substituted judgment standard, the best interest standard, and the reasonable treatment standard, that are very intuitive. It's things that you probably do, most of us do intuitively. So you can simply explain that to a family or a surrogate decision maker. And just structuring your mindset in this way can give them a pathway to make a decision rather than being overwhelmed by the situation. It'll give them something to focus on, something to hone their vision towards, so they can arrive at a good decision on behalf of the patient. So, as always, feel free to reach out if you have any questions about this content. Thanks.